Hello everyone. Let's begin our discussion on this module, disorders of the mitral valve. Okay. All right. So, disorders of mitral valve, to begin with, let's try to understand some basics about the mitral valve. Out of all the four heart valves, the mitral valve is actually the most complex one. Okay, and in fact, this is the valve that is most often associated with disease process out of all the four heart valves. Now, talking about the mitral valve, there are three main conditions that can affect the mitral valve. And what are those three conditions? Number one, you can have an obstruction or stenosis of the valve. Okay, you can have an obstruction or stenosis of the valve, that is number one. Number two, you can have a leakage or a regurgitation that is involving the mitral valve. Okay, a leakage or regurgitation. And number three, there can be a bulging backward of the valves, during the valve closure, or you can say there can be a prolapse of the valve. Okay, there can be a prolapse of the valve. So obstruction or stenosis, a regurgitation, and a bulging backward, that is prolapse. These are the main disorders that can affect the mitral valve. Now, out of these three entities, the most common one will be a prolapse. Okay, the most common disease condition affecting the mitral valve will be a prolapse, and the least common one will be stenosis. Okay, will be stenosis. The least common one will be a stenosis. Okay, so I hope that part is clear. Now let's move forward and have some more discussion on the structure and function of mitral valve. Okay, let's have a short discussion on the structure and function of mitral valve. Okay, structure and function of mitral valve. So mitral valve, this is actually consisting of two leaflets. Okay, there is an anterior and posterior leaflet. So these two leaflets are arranged to form a ring. Okay, so this consists of two leaflets arranged to form a ring. Okay, consists of two leaflets arranged to form a ring. And I told you this is having a complex structure, correct? No? So this anterior and posterior mitral leaflets, they have a very complex supporting structures. Okay, so they have some complex supporting structures. Okay, complex supporting structures. Now, what do I mean by this complex supporting structures? This refers to the muscles as well as tendons which are involved in supporting the mitral valve. In fact, you can have the mitral valve leaflets being supported by the chordae tendineae, the papillary muscles. So it's almost like just like the strings of a parachute, the mitral leaflets are supported by the supporting structures. Okay, so it's just like the strings on a parachute. Okay, just like strings on a parachute. Okay, so let me just take you to the basic structure here. Okay, yes, so you can see the mitral valve here. Yes, so there is an anterior leaflet and a posterior leaflet. So there is a mitral valve between the LA and the LV. and you can see the strings, okay, the strings on the parachute, the chordae tendineae. You can also see the papillary muscles here. So all this is actually involved in supporting the mitral leaflets. Okay, very clear. Now coming to the function of the mitral leaflets. So the mitral valve, you can say that this is actually a gateway between the left atrium as well as the left ventricle. And as the heart beats, these leaflets will open and close. It is acting like a one-way valve. Okay. So what happens is, let's see what happens to the mitral valve during the cardiac cycle. So a bit regarding the function of mitral valve. So I told you this is acting as the gateway. Yes, gateway between LA and LV, and this is opening and closing as the heart beats. And let's see what happens during a diastole. Okay, during a diastole. So during diastole, you tell me what happens to the LV. The LV is in a relaxed state. Okay, LV is in a relaxed state, correct? So what happens is, at that particular time, the valve actually opens, the mitral valve opens, and there is a blood flow from the atrium to the ventricle. Okay, so LV is relaxed, the valve opens, and there is a blood flow from LA to LV. Yes, there is a blood flow from LA to LV. That's clear? All right. Now see what happens during systole. Okay, what happens during systole? Now during systole, what happens is the valve actually closes. Okay, the valve opens during diastole, closes during systole. So the valve closes, and then what happens is, the LV blood, okay, the LV is actually ejecting blood to the rest of the system during the systole, and this is actually a forward propagation of blood, and the valve, the mitral valve, normally it prevents the blood from leaking back to the LA. So there is a forward flow of blood from the LV, and importantly there is, the valve actually prevents backflow. Okay, the valve prevents backflow. Okay, I hope that part is very clear. Just the very basics, very basics. Now I am going to teach you with a couple of simple figures on what happens to the heart in diastole and what happens to the heart during systole. Okay, now let's see what happens during diastole. So what happens to the heart in diastole? We'll see what happens normally and what happens in disease process. So in diastole, in normal individuals, well, I have told you the valve opens, there is a flow from LA to LV. So in diastole, in normal individuals, what happens is a LA to LV, okay, and the ventricle is relaxed, it is being filled. Now just let me show you the figure. Yeah, so this is what happens. You can clearly see this is the LA, this is the LV, and the red arrow is pointing to the flow of blood from the LA to LV. The ventricle is getting filled. Okay, the valve is open, and this is actually the mitral valve here in the inset that you are seeing. So this is almost forming a ring. It's actually consisting of two leaflets. Okay, this is what happens in normal individuals during diastole. Okay, but what happens in patients with mitral stenosis? That is what we are interested in. Okay, what happens during mitral stenosis? So in mitral stenosis, yes, there is abnormality The valve is having a characteristic domed appearance. Okay, it is having a characteristic domed appearance. All right. And the valve, the disease process, what exactly happens in mitral stenosis, we'll see in the discussion on the mitral stenosis module. But understand that you will have a restricted opening of the valve. Okay, the restricted opening of the valve, and the valve will be thickened. Okay, you will be having a thickened valve. You will be having a thickened valve. And as a result of which, there is a restricted opening is there. So as a result of which, what will happen to the LA? Definitely there will be a back pressure and LA will be enlarged. You will have a enlarged left atrium. Okay, the LA will be enlarged. So let's just have a look at the disease process here. So this is mitral stenosis for you. Okay, mitral stenosis. So you will have a damaged mitral valve. You can see the disease process. Okay, we'll come to the disease process soon in the next module. And here you can see there is a restricted opening. Yes, are you able to appreciate the restricted opening of the mitral valve? And you can see that the LA is actually getting enlarged. Okay, which is again quite obvious. Okay, so this is what happens in mitral stenosis. Okay, all right. So we have seen what happens to the heart in diastole. Let's try to see what happens to the heart in systole, both in normalcy and disease condition. Heart in systole. Okay, so again let's see normal individuals. So in normal individuals, the valve is actually closed. There is no leakage of blood back to the LA. Okay, you will have a closed valve. There is no leakage to LA. Okay, all right. But suppose, in disease stage, suppose there is a prolapse of the leaflet, mitral leaflet, and there is an associated mitral regurgitation. Okay, just think of a condition where an individual is having prolapse and an associated mitral regurgitation. Now what happens here? So in this state, the valve does not close completely, and there is actually a bulging of a part of the leaflet back into the left atrium. Okay, so the leaflet bulges to LA. Okay, the part of the leaflet is bulging to the LA, and because of which what will happen is that as the disease actually goes by, yes, there is a regurgitant flow of blood, so there can also be an enlargement of the LV. Okay, we learn about chronic mitral regurgitation, but understand for the time being that there can be an enlarged LV. Okay, there can be an enlarged LV as a result of a chronic MR. Okay, as a result of a chronic mitral regurgitation, you can have an enlarged LV. Let's just see normalcy versus disease process. So this is what actually happens to the heart in case of systole. Okay, this is what happens in systole. So you can see a closed mitral valve normally, closed mitral valve. And you can see that this is LA. So at that particular stage there is no backflow. Okay, there is no backflow at all. There is no backflow. All right. So what happens in disease states is that you can see a damaged mitral valve. This is again what happens during systole. So there is some sort of a prolapse and a mitral regurgitation. So you look at this, you can see there can be a regurgitation, okay, of blood to the LA. And if it is a chronic severe regurgitation, as the disease progresses, you can have an enlargement of the LV. Okay, so this is basically what happens in disease processes. So I hope you just got a very basic idea regarding the diseases that can affect the mitral valve, and now we are going to see regarding the individual disorders that affect the mitral valve. Okay.